What to expect from transitional cell carcinoma surveillance. If you or a loved one has been diagnosed with transitional cell carcinoma of the bladder, understanding what comes next can feel overwhelming. Surveillance is a key part of managing bladder cancer after initial treatment. It is designed to catch any signs of the cancer returning or progressing early, so treatment can be started promptly. The main tools used in surveillance include cystoscopy, urine tests, and imaging studies. The frequency and type of these tests depend on your risk level, which is determined by factors like tumor size, grade, and whether the cancer has invaded deeper layers. Cystoscopy is the primary method used to look inside the bladder. It involves inserting a thin tube with a camera into the bladder through the urethra. The first cystoscopy is usually scheduled within 3 to 4 months after treatment. If no tumors are found at this visit, the next cystoscopy might be scheduled every 6 to 9 months for the following year. After 5 years without recurrence, your doctor and you will decide on the best follow-up plan. For patients considered at intermediate risk, cystoscopies and urine tests are typically done every 3 to 6 months during the first 2 years. Then, the interval may extend to every 6 to 12 months for years 3 and 4, and once a year afterward. High-risk patients, especially those with more aggressive tumors, may need cystoscopy and urine tests every 3 to 4 months for the first 2 years, then every 6 months for the next 2 years, and annually after that. Urine cytology is a lab test that examines urine for cancer cells. It is often done alongside cystoscopy, especially in higher risk cases, to help detect any signs of recurrence or disease progression that might not be visible during cystoscopy. Because transitional cell carcinoma can also develop in the upper urinary tract, such as the kidneys and ureters, imaging studies are sometimes recommended. These include procedures like computed tomography urography or intravenous urography. Usually, low-risk patients do not need routine upper tract imaging, but those at intermediate or high risk should have imaging every 1 to 2 years. This is especially important if the original tumor was near the bladder's trigone area, which can be associated with a higher chance of tumors in the upper urinary tract. Surveillance is generally continued for at least 5 years. However, patients with carcinoma in situ or high-risk disease may need lifelong follow-up because of the ongoing risk of recurrence and disease progression. In some cases, small, low-grade tumors can be treated during cystoscopy with procedures like fulguration, which involves burning off small tumors to avoid more invasive surgeries. These treatments are part of the ongoing surveillance process. It is important to remember that surveillance plans are personalized. Your healthcare team will tailor the schedule based on your specific situation. Regular communication with your doctor is essential. If you notice new symptoms like blood in the urine, pain, or changes in urination, report them promptly. Following these guidelines helps catch any issues early, increasing the chances of successful treatment and helping to preserve bladder health. Always consult your healthcare provider for advice suited to your individual case and stay informed about the latest recommendations from trusted medical sources.